I'm Dr. Behzad Bernous, though many people know me simply as Dr. B or Dr. Bibi. Hello and welcome to another episode of Astane. Today I want to talk to you about something deeply human, something most of us quietly carry within ourselves throughout life, the endless question of the mind. Why do I react the way I do? Why do I repeat certain patterns? What truly motivates me? Why do I think differently from others? Who am I beneath my habits, fears, emotions, and defenses? For many people, these questions remain unanswered for years and years, sometimes for an entire lifetime. The mind continues searching, wondering, interpreting, and often suffering in silence without fully understanding itself. But these questions do not always have to remain mysteries. One of the things I've learned throughout years of working as a clinical psychologist is that understanding ourselves is possible. There are ways to explore the deeper structure of the mind, the personality, emotions, cognition, attention, memory, trauma, and behavior in a meaningful and scientifically grounded way. And one of the most powerful tools we have for this journey is called psychological testing and assessment. When done properly with a trained psychologist, psychological assessment can help uncover patterns that are often invisible to us. It can help explain why we think the way we do, why we struggle in certain areas, why certain relationships repeat themselves, or why life sometimes feels harder than it should. These psychological measures and assessment methods have been developed, researched, and refined over many decades, and they continue to offer valuable insight into the human psyche. So today I want to introduce you to the world of psychological testing, what it is, how it works, why it matters, and how it can become a doorway toward deeper self-understanding and healing. So, what is psychological assessment? Psychological assessment, sometimes referred to also as psychological testing, is a comprehensive and systematic approach and process to understand how a person thinks, feels, behaves, and functions. It goes far beyond the conversation. Assessment allows us to evaluate multiple domains of functioning, including cognition, attention, memory, behavior, emotional regulation, personality patterns, and other visible and invisible aspects of the psyche that influence daily life. Using standardized tools, clinical interviews, behavioral observations, and collateral information, we are able to build a detailed, evidence-based understanding of an individual's psychological profile. In many ways, psychological assessment serves as a map, helping us see the full landscape of persons' internal and external experiences. Why psychological assessment is important? Well, when we begin therapy, we often focus on what is immediately in front of us. What brought you in, what you're struggling with today, and so forth. However, beneath that, there are often underlying factors that are not yet fully visible. This is where comprehensive psychological assessment becomes critical. A thorough evaluation can uncover issues that may have been overlooked or misunderstood, such as ADHD, autism spectrum traits, trauma-related presentations, mood patterns, or learning difficulties. This is not about assigning labels. No, it is about clinical clarity. When individuals come to understand what is truly happening within their psychological functioning, there is often a sense of relief. Experiences that once felt confusing or overwhelming begin to make sense. With this level of understanding, both the individual and the clinician can move forward with more targeted, meaningful, and effective interventions. From a scientific standpoint, standardized psychological assessment is well established as a reliable and valid method for diagnostic clarification and even treatment planning. So why we specialize in psychological assessment? Well, assessment is not simply about administering tests. It requires the ability to integrate complex data, recognizing patterns, differentiate between overlapping conditions, and translate findings into practical, individualized recommendations. This is a level of work that requires focused training and experience. My team and I are known in the community for providing comprehensive, high-quality evaluations that are both clinically rigorous and deeply personalized. We take the time to understand the whole person, the history and context that the person is presenting within. So that the conclusion we reach after all of this is an accurate and meaningful conclusion. Who conducts psychological testing? Psychological assessment is a specialized service that requires advanced training and clinical expertise. At my practice, the intake session and the overall direction of the evaluation are conducted by a licensed clinical psychologist. The psychologist then determines the scope of the assessment, selects the appropriate instruments, and ensures that the evaluation is aligned with the individual's specific needs. The testing administration itself is often conducted by clinical psychologists or trained psychometricians. These professionals are specifically trained in standardized test administration and scoring procedures. Their role is to ensure that each measure is administered with precision, consistency, and strict adherence to standardized protocols, which is essential for the validity and reliability of the results. Once all data is collected, the licensed psychologist is responsible for interpretation and integration of the data. This includes reviewing test scores, clinical interview, data, behavioral observations, and any collateral information from parents, teachers, or any other sources. Then the psychologist prepares the comprehensive diagnostic report and conducts the feedback session with the client. It is important to understand that psychological testing is not a general mental health service. While many mental health professionals provide therapy, comprehensive psychological assessment is a distinct area of specialization that is mostly done by the trained individuals and psychologists, and it requires expertise in psychometrics, differential diagnosis, and complex clinical formulation. This structure and collaborative process ensures that the final conclusions are accurate, reliable, and clinically meaningful. So how does it look like? The first step in the session is we collect detailed clinical interview and we gather information with current concerns, developmental history, medical background, educational and occupational functioning, and also psychosocial context. The second phase is the testing administration that could happen in one or multiple sessions depending on the scope of the evaluation. Testing is usually conducted in person, although some components of it may be done in a hybrid format. During this phase, we assess areas such as cognitive functioning, attention, memory, personality, and emotional processes using standardized measures. When appropriate, we also gather collateral information from parents, teachers, or other informants to ensure a comprehensive understanding of your situation. The third phase is interpreting and report writing. Here, the psychologist integrates all sources of data into a cohesive clinical formulation. The final report includes diagnostic impression and individualized recommendations. The final step is the feedback session. In this session, we review the findings with client, explaining the results in a clear and meaningful way, and discuss the next steps. This is a collaborative process focused on understanding and empowerment. So, what types of assessments we offer? Diagnostic and neurodevelopmental assessment, such as evaluation for ADHD, autism spectrum disorder, and learning disabilities. These assessments help identify patterns in attention, executive functioning, social communication, and academic performance. Another type is cognitive and neurocognitive assessments. These assessments include IQ testing and broader neurocognitive evaluations. They assess intellectual ability, memory, processing speed, attention, and executive functioning, and are often used in academic, medical, or neurological contexts. Another type is academic achievement test. These evaluations focus on reading, writing, and mathematics skills. They are often conducted alongside cognitive testing to identify learning disorders and guide educational planning. Another type is personality and emotional functioning assessment, including personality testing, trauma-related evaluations, and they can help clarify emotional patterns, coping mechanisms, interpersonal functionings, and underlying psychological dynamics. Forensic and legal evaluations also are another type that provide assessments for legal purposes, including forensic and immigration-related evaluations. These are usually conducted in accordance with legal standards and requirements. Health and medical-related evaluations are also another type, such as the ones done for pre-surgical evaluation that assess psychological readiness and potential risk factors related to medical procedures. Relational and premarital assessments. These assessments focus on interpersonal dynamics, communication patterns, and expectations, also helping individuals and couples build insight and strong relational foundations. Ultimately, psychological assessment is about understanding. It allows us to move beyond surface level concerns and gain a deeper, more accurate picture of the individual. Whether someone is seeking answers, clarity, diagnosis, or direction, assessments provide a structure and reliable pathway towards that understanding. And before we close, I want to leave you with this thought. Psychological assessment is not just about tests, scores, or labels. At its best, it is about understanding a human being more deeply and more compassionately. This work is done through the meeting of the human mind with carefully developed psychological sciences. These assessments are created by people, interpreted by trained clinicians, and carried out through real human connection. My team and I take the time to sit with people face to face, to listen carefully, to understand the full picture, and to provide a level of care that cannot simply be reduced to an online questionnaire or a quick conversation. This process requires years of training, clinical precision, ethical responsibility, and thoughtful follow-through. But beyond the science and expertise, our goal is always to make the experience meaningful, supportive, and transformative for the individual and for the people who care about them. If you or someone you love is considering psychological assessment, my team and I are here to guide you through that process with care, professionalism, and compassion. Thank you for taking the time to learn more about psychological testing, and thank you for remaining curious about the human mind and about yourself. Please take a good care of yourself. As always, thank you for being here with us at Astana.